The Alberta Dental Association College is in a position to protect the public from mistreatment by dentists, and they have a long history of an association with a dental program that has been known to be related to teaching over-treatment related to full mouth crowns with the LVI technique. In the LVI listing, we have a dentist here, Dr. Tamari Height, who was basically selected to become a poster girl for the discipline against LVI in 2013. Now this treatment probably would have occurred quite before that. It says, according to the listing here, that the treatment occurred in June and October of 2008, and it took until 2013 to be processed. And the basic summary of this case is a patient was told they had the option of straightening their teeth with orthodontics or with 10 veneers, and the patient was referred to an orthodontist but chose not to get that done, and wanted the veneer approach, which included aggressive reduction of the teeth to make them straight, and this is always associated with a risk of endodontic complications or root canal requirements, which is also something that on occasion occurs with orthodontics, but it is more likely if we're having to drill the teeth straight. So unfortunately, the patient had some root canal complications, got into a little squabble with who should pay for it, and this resulted in a complaint to the dental authority, which preceded a long investigation. And the odd thing is that in this case, the dentist was ordered to pay $13,500 to replace the veneers and $130,000 in investigation hearing costs. Now, according to the dentist, the costs for her legal fees were approaching $1 million. So that would give you an indication of the prolonged and sloppy back and forth that would have gone on between the lawyers to figure out a simple case of lower front teeth being veneered. And again, the risks were explained to the patient, but when something goes wrong, it's common that the patient pretends they didn't know. So I'm going to just say, well, maybe this dentist, did the right thing in discussing the different options. The patient chose a treatment that had higher risks and just got cranky with the dentist when one of the complications did come true. So you can't just paint all LVI trained dentists as devils. They just have an approach that was a little bit heavy-handed in the way that they would push crowns and veneers as a cure-all. And again, if you present all the treatment options and the patient still chooses to go with the more risky approach, that is up to the patient, and if it's properly documented, the dentist should not be disciplined in this manner. So let's just say that there are new techniques that are an alternative between traditional orthodontics and instant orthodontics with veneers, and these other techniques may cause some concerns with the specialists that are affected by the competition, but that's another subject.